There's a phrase that many women hear at some point in their fertility journey: everything looks normal. And that puts them into the category of unexplained infertility. I'm going to say something right now that might surprise you. I don't believe in unexplained infertility. Because when pregnancy isn't happening, there's almost always a reason or a pattern. It just hasn't been fully interpreted yet. When you're told everything is normal, it can momentarily feel reassuring. But when month after month passes and nothing changes, normal stops feeling comforting, and it starts feeling incomplete and maybe even inaccurate. It raises more questions than it answers. Hi, I'm Batya. I'm a fertility specialist, a Chinese medicine practitioner, and a midwife. I work with women who are trying to conceive, especially when everything looks normal, but something still feels unresolved. Around here, we don't force the body. We learn how to understand what it's responding to. So today, I want to widen the lens, because unexplained rarely means that there's no reason. It usually means that the current evaluation wasn't designed to detect the kind of pattern that's present. And by the end of this episode, you'll understand why unexplained often isn't mysterious at all. It's simply uninterpreted. So here's what you need to internalize. When you have a diagnosis of unexplained, it usually means that the current evaluation doesn't yet have the language or the framework to fully describe the pattern that's present. You see, modern medicine is excellent at ruling out major barriers: blocked tubes, severe sperm dysfunction, clear ovarian failure, significant structural abnormalities. And of course, that's essential. But not all fertility influences are so dramatic. Some are subtle structural factors like adhesions, scar tissue, restricted blood flow, fascial tension. And these don't always appear clearly on standard testing, yet they can still significantly influence implantation, egg quality, and overall reproductive function. And beyond structure, reproduction is obviously governed by signaling and regulation. Hormone signaling, immune tone, metabolic stability, nervous system coordination. Your reproductive system isn't just an organ, it's a responsive network. Some barriers are structural, many are signaling based. All require interpretation. Labs can be normal while coordination is not. The issue isn't mystery, it's mapping. Let's make this concrete. A few years ago, a woman that I'll call Tammy came to see me feeling stuck and exhausted. She was in her mid-30s and she already had 2 children, both conceived through IVF. This time, though, the IVF wasn't working. Her testing looked normal, and she kept hearing that familiar phrase, unexplained. What made it so painful wasn't just the delay, but it was the lack of direction. So when we sat down, we didn't look for a magic supplement. We widened the lens. We looked at her history, her exposures, her physiology, and her cycle patterns. And one detail stood out: meaningful mercury exposure from older dental materials. Now let me be clear, this is not the answer for everyone, but in her case, it mattered. You see, heavy metals can influence immune signaling, inflammatory tone, hormone communication, egg quality, and the implantation environment. And unfortunately, they are rarely part of a standard fertility workup. So instead of just pushing harder, we focused on strengthening her body's ability to buffer and regulate that mercury load while she continued her medical care in the IVF clinic. She conceived fairly quickly after we started, and unfortunately, that pregnancy ended in a loss, and of course that loss mattered. But clinically, it also told us something important, because egg development doesn't happen in real time. It actually takes about 3 to 4 months to meaningfully influence egg quality, since the follicle that ovulates today actually began developing months earlier, which means that the internal environment she had been living in was still influencing that first conception. So we stayed the course, we continued our acupuncture, and a few months later, she conceived again without IVF intervention. And that pregnancy held. 9 months later, she gave birth to a healthy baby, and everyone was happy. But about a year later, something interesting and super important and surprising happened. She conceived again, this time without even trying. She was surprised, and I was surprised. But we see once the underlying physiological burden had been reduced, her system was no longer compensating, and her fertility no longer required intervention. What had originally been labeled unexplained wasn't mysterious. It was a pattern that hadn't yet been interpreted. It wasn't a diagnosis. It was an incomplete map. The point of this story is not go chase Mercury. The point is this: unexplained infertility is often not a diagnosis. It is a signal that the map is incomplete. And when that map becomes more precise, the body often becomes more responsive, sometimes quickly, sometimes gradually, but in a way that finally makes sense. So when you're told everything is normal, most women respond in one of two ways. Either they start chasing everything, or they just shut down and wait. But actually, there's a third path. And this path is where strategy begins. And I'd like to share it with you by outlining 3 possible approaches that breed hope and not fear. So first of all, look for patterns, not problems. Instead of asking, what's wrong with me? Ask, what is my body consistently responding to? Patterns live in timing, inconsistency, symptom clusters, and cycle behavior over months, not in one lab snapshot. Number 2, keep in mind that regulation matters more than numbers. So a normal hormone value does not guarantee coordinated signaling. Fertility is not just about whether you can ovulate. It's about whether your internal environment is coherent enough for the body to invest in implantation. Numbers can be normal, and coordination can still be off. Finally, number 3 is think in systems, not organs. Unexplained infertility is rarely about one broken part, although sometimes it is. But more often it's about communication between systems: the brain, the ovaries, the immune system, the metabolism, your gut, your nervous system. When the communication is noisy or strained, then reproduction can stay on pause, even if each individual part looks fine. So the question becomes, where is the signal getting distorted? And more importantly, what would restore the clarity? So if you've been told that everything looks normal, but pregnancy still hasn't happened, I want you to hear this. It doesn't mean that nothing's happening. It means that the physiology is layered, and layered physiology requires a wider and often deeper lens, not more panic. Because you are not random. Your body is not mysterious. There's almost always a pattern and a reason. Often we just need to learn how to see it. So if you'd like a grounded place to begin widening your lens, I created a short guide called 5 Fertility Secrets Your Body Wants You to Know. It walks you through the foundational systems that influence fertility readiness and the evidence-based strategies that you can take to help correct and stabilize signaling, especially in areas that don't always show up on standard testing. And you'll find it linked below. In the next episode, we're going to move one layer deeper. If unexplained is often a mapping problem, then we need to ask, what's actually shaping egg development beneath the surface? Because egg quality is not a verdict. It's a reflection of physiology, and physiology can be influenced. So I want to leave you with this. Unexplained infertility doesn't mean impossible. Often it simply means uninterpreted. And once the interpretation becomes clear, the system finally knows how to respond.